Once facing the brink of annihilation due to HIV, Botswana has transformed into a global beacon of hope in the fight against the virus, particularly in preventing mother-to-child transmission. At the dawn of the millennium, the nation was grappling with an HIV epidemic so severe that its leaders feared for the survival of the entire population. A staggering 1 in 8 newborns were reportedly infected at birth, with mother-to-child transmission rates soaring between 20 and 40%, according to UNAIDS data. This grim reality led to a near doubling of mortality rates among children under 5 between 1990 and 2000, primarily attributed to HIV complications. In the face of such adversity, President Festus Mogae declared in 2001 that Botswana was threatened with extinction. The gravity of the situation was underscored by Dr. Loto Mazani, a retired pediatrician, public health official, and academic at the University of Botswana. If your whole population was infected in utero, at birth, or during early infancy, with the majority either dying or living with significant disability, you could see there was no future, he lamented. However, amidst this crisis, Botswana embarked on a journey that would redefine its relationship with HIV. Under the leadership of Dr. Mazani, backed by President Mogae, a series of groundbreaking interventions were implemented, slashing mother-to-child transmission rates to less than 1% over 2 decades. These efforts were so effective that earlier this year, Botswana became the first country with a high HIV burden to achieve the World Health Organization's Gold Tier status for eliminating mother-to-child HIV transmission as a public health threat. The transformation was so dramatic that the WHO initially doubted the reported figures, with Dr. Ava Avalos, an HIV specialist and technical advisor to Botswana's health ministry, recounting how international skepticism persisted until the undeniable success of the program forced a reassessment. Today, new pediatric infections are so rare that fewer than 100 HIV-positive infants are born annually, with each case meticulously audited to understand its occurrence. Achieving this milestone required a combination of political resolve, investment in scientific infrastructure, and a comprehensive public health education campaign. Among the significant challenges was convincing HIV-positive mothers to forego breastfeeding, a cultural norm due to the risks of transmission. Mothers felt ostracized, but over time, the stigma associated with formula feeding diminished, Dr. Mazani reflected. A pivotal moment came in 2013, when Botswana adopted the WHO's Option B+ strategy, making a 3-drug antiretroviral therapy freely available to all pregnant and breastfeeding women living with HIV. This move positioned Botswana as a global pioneer, as it was one of the first countries to implement the strategy on a national scale. Professor Roger Shapiro of the Harvard T.H. Chan School of Public Health highlighted that 3-drug therapy was by far the best way to both treat mothers for their health and effectively halt vertical transmission. Despite these strides, research suggested that additional measures were necessary to prevent pediatric infections entirely. It was discovered that a significant number of mother-to-child transmissions occurred when mothers contracted HIV unknowingly during pregnancy, infecting the unborn child in the 3rd trimester. To address this, Botswana established advanced laboratories capable of processing thousands of PCR tests and initiated repeat HIV testing for all pregnant women. This enabled swift initiation of antiretroviral treatment for newly diagnosed mothers, further reducing the risk of transmission to their babies. Botswana's program stands out due to the country's near-universal antenatal coverage, ensuring that the vast majority of women access healthcare services and give birth in hospitals rather than at home. This also facilitates immediate testing and treatment of infants born to HIV-positive mothers. The success of this testing regimen has led to a unique cohort of children and adolescents with HIV, whose viral loads are nearly undetectable, thanks to lifelong antiretroviral therapy since birth. These children are now being considered for experimental trials aimed at using cutting-edge treatments to achieve a complete cure. At the International AIDS Society conference in Rwanda, researchers discussed the potential of these children as ideal candidates for trials involving broadly neutralizing antibodies, BNABs, a novel class of HIV drugs capable of targeting various strains of the virus and stimulating the immune system. The hope is that after a specific time frame, some of these children will be able to live without any medication, effectively cured of HIV. While a cure has always been the holy grail for HIV researchers, the urgency of such trials has intensified amid foreign aid cuts and economic turmoil. Botswana's HIV program, though more resilient than many others, faces challenges due to economic downturns and tariff issues. Our HIV program is much more precarious now, Dr. Avalos noted. Previously, if we faced shortages, foreign partners could assist us, but those systems are no longer in place. Given Botswana's remarkable success in virtually eliminating mother-to-child transmissions, the availability of the necessary infrastructure for clinical trials, and a suitable population of children with a potentially higher likelihood of being cured, there is a sense of optimism that if a cure breakthrough is possible, it might well occur in Botswana. If we can't manage it here, I have nowhere we could do it, Dr. Avalos concluded.